Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. When most people imagine surgery, they picture the operating room, the surgical lights, the instruments, and the moment the first incision is made. But many operations begin long before the patient ever enters the operating room. Before surgery can take place, the healthcare team needs a detailed understanding of the patient's anatomy. Where is the problem located? How large is it? Which blood vessels, nerves, or organs are nearby? And what is the safest way to reach it? For many modern operations, those answers begin with medical imaging. Today, we are going behind the scenes to discover how CT scans, MRI, ultrasound, PT imaging, three-dimensional models, and surgical navigation help transform medical images into a detailed surgical roadmap. Medical imaging is often first used to identify what is causing a patient's symptoms. A CT scan might reveal a complicated fracture. An MRI could identify a tumor near important nerves. Ultrasound may show an abnormality involving an organ or blood vessel. PET imaging may help determine whether a known cancer appears active or has spread to other areas. Once the condition has been identified, the medical question begins to change. The healthcare team is no longer asking only, "What is wrong?" Now they must ask, "How can it be treated? Can the abnormality be safely removed? What structures must be protected? And what challenges could the surgical team encounter?" Medical images provide much more than a diagnosis. They allow surgeons to study the patient's unique anatomy before the operation begins. CT and MRI examinations usually produce a large series of individual images. Each image represents a thin section through the body. When these images are viewed together, they allow the healthcare team to examine anatomy from many different directions. Specialized software can also be used to isolate particular structures. This process is often called segmentation. Bone may be separated from soft tissue. Blood vessels can be highlighted. A tumor can be outlined. And the relationship between the abnormality and nearby anatomy can be examined in detail. The information can then be transformed into a three-dimensional digital model. Instead of looking only at flat images, the surgeon may be able to rotate the anatomy, examine it from different angles, and take precise measurements. The surgical team may evaluate the size and shape of a tumor, the course of a blood vessel, the location of important nerves, the amount of healthy tissue surrounding an abnormality, or the exact dimensions needed for an implant. This imaging-based roadmap helps the surgical team anticipate challenges before the operation begins. Orthopedic surgery provides one of the clearest examples of how imaging helps guide planning. A standard X-ray may show that a bone is broken, but when the fracture is complex, CT can reveal details that may be difficult to appreciate on a single X-ray. It can show the exact fracture lines, how far the bone fragments have moved, whether the fracture extends into a joint, and whether several pieces of bone are overlapping. Three-dimensional reconstructions can help the surgeon visualize the fracture as though they were holding the bone in their hands. For joint replacements, imaging may also be used to measure the patient's anatomy and estimate the size, angle, and position of the implant. In selected cases, patient-specific cutting guides or surgical templates may be created from the imaging data. The imaging does not perform the surgery, but it helps the surgeon enter the operating room with a clearer understanding of the problem and a carefully considered plan. In brain surgery, planning can involve millimeters. A surgeon may need to reach an abnormality while avoiding regions responsible for speech, movement, vision, or other essential functions. MRI provides detailed images of the brain and surrounding soft tissues. In some patients, additional MRI techniques may provide even more information. Functional MRI can help identify areas of the brain associated with particular activities, such as speaking or moving a hand. Diffusion-based imaging can help display major white matter pathways that carry signals through the brain. These different types of information may be combined to create a more complete surgical map. Before the procedure, the surgeon can study the location of the abnormality and its relationship to important functional areas and nerve pathways. During some operations, preoperative images are also used by a neuronavigation system. This works somewhat like a highly specialized GPS system. The patient's anatomy is matched with the medical images, allowing the surgical team to track the location of instruments in relation to the previously acquired scan. However, navigation is a tool, not a replacement for surgical expertise. The images must always be interpreted within the realities of the procedure, including the possibility that tissues can shift after surgery begins. Cancer surgery often requires information from more than one imaging examination. CT may help show the size and location of a tumor and its relationship to nearby organs. MRI may provide greater detail in certain soft tissues. PET imaging may help identify areas of increased metabolic activity and may be used in selected cancers to evaluate whether disease appears to have spread. These examinations are not necessarily competing with one another. Each may answer a different part of the clinical question. Before surgery, the team may need to understand: where does the tumor begin and end? Is it close to a major blood vessel? Does it involve nearby organs? Can it be removed while preserving enough healthy tissue? And is surgery the most appropriate treatment? Imaging findings may be reviewed during a multidisciplinary meeting involving radiologists, surgeons, oncologists, pathologists, and other healthcare professionals. Together, the team uses the available information to develop a treatment plan suited to the individual patient. Medical imaging also plays an important role in planning many heart and blood vessel procedures. CT angiography can produce detailed images of the heart, aorta, and major blood vessels. For certain structural heart procedures, measurements may be taken from the images to evaluate the size and shape of the valve, the surrounding anatomy, and the pathway that medical devices may need to travel. Ultrasound, including echocardiography, can provide real-time information about the movement of the heart, the function of its valves, and the direction of blood flow. MRI may also be used in selected patients to evaluate the heart structure, function, and tissue characteristics. By combining anatomical and functional information, the healthcare team can determine whether a procedure is appropriate and prepare for potential challenges. Sometimes, the digital surgical plan can become a physical object. Using CT or MRI data, selected anatomical structures can be separated from the surrounding images and converted into a printable three-dimensional model. The result may be a patient-specific replica of a bone, blood vessel, organ, or complex abnormality. These models may help surgeons better understand unusual anatomy, consider different surgical approaches, or practice parts of a particularly complex procedure. They can also help explain the planned operation to patients and families. In some situations, imaging data may also contribute to the design of patient-specific guides, templates, or implants. However, not every operation requires a printed model. Three-dimensional printing is generally reserved for cases in which the additional information is expected to meaningfully support planning, education, or treatment. The role of imaging does not always end when surgery begins. Some procedures use imaging inside the operating room to confirm position, guide instruments, or evaluate the result before the operation is complete. Fluoroscopy can provide moving X-ray images during orthopedic, cardiovascular, and other procedures. Ultrasound can provide real-time images without ionizing radiation and may be used to help identify blood vessels, organs, or abnormalities during surgery. Navigation systems can connect surgical instruments with preoperative CT or MRI data. Some specialized operating rooms also include CT, cone beam CT, MRI, or other imaging equipment. This may allow the team to obtain updated images during the procedure. However, each technique has its own strengths, limitations, and safety requirements. The imaging method is selected according to the procedure, the clinical question, and the needs of the patient. Creating a surgical roadmap requires teamwork. Medical radiation. Technologists, MRI technologists, sonographers, and nuclear medicine technologists acquire the images. Radiologists interpret the examinations and may help determine which imaging techniques are most appropriate. Specialists in advanced visualization may create three-dimensional reconstructions or printed models. Medical physicists support imaging quality and safety. Surgeons combine the imaging findings with the patient's history, physical examination, and other medical information. Nurses, anesthesia teams, and many other professionals prepare for the patient's care before, during, and after the operation. The final surgical plan is built through the combined expertise of the entire healthcare team. Surgical planning continues to evolve. Artificial intelligence is being studied and used in selected settings to assist with tasks such as identifying anatomy, producing measurements, and supporting image analysis. Virtual and augmented reality systems may allow healthcare professionals to interact with three-dimensional anatomical models in new ways. Patient-specific simulations could help teams compare different surgical approaches before selecting a plan. Robotic systems may combine imaging, navigation, and precise instrument control, and researchers are exploring increasingly detailed digital representations of individual patients. Some of these technologies are already used in specialized centers, others remain experimental or are still being evaluated, but the direction is clear. Medical imaging is becoming more deeply connected with how surgeries are planned, simulated, and performed. A successful operation often begins long before the first incision. It begins with questions, careful measurements, detailed images, and a team studying the safest path forward. Medical imaging allows surgeons to understand a patient's unique anatomy, anticipate potential challenges, and prepare for procedures with greater information. It can transform hundreds of individual images into a surgical roadmap, a digital model, a physical replica, or a navigation system that supports decisions inside the operating room. Medical imaging does not replace the skill and judgment of the surgical team. It strengthens the information available to them. It transforms images into plans, and plans into patient care. Thanks for watching In the Know Medical Imaging, where we make medical imaging easy to understand. If you enjoyed this video, please like, subscribe, and share it with someone who would find it helpful. We'll see you in the next one.